Hello everyone, my name is Ross Aiello, and today for the class Bioimaging, class code BIOMEDE 4110, I will be presenting a short set of slides on the non-invasive imaging of peripheral nerves. All of the information in this presentation is based off a scientific article that is included in the very last slide of this presentation. So first off, here's a little bit about the peripheral nerve system and nerve damage, which is otherwise termed as neuropathy. The peripheral nerve system, otherwise known as the PNS, includes a network of nerves that transmits signals from the central nervous system to the rest of the body. The PNS is incredibly important as it includes many different functions ranging from control of bodily functions including bladder control and sensory reception. Damage to the PNS, otherwise known as neuropathy, usually occurs in different nutritional, vitamin imbalances, alcoholism, or overexposure to certain toxins. Neuropathy is incredibly common as it affects over 15 million people. Today, the presentation will cover 4 different imaging modalities that attempt to understand neuropathy qualitatively and quantitatively. A combination of non-invasive imaging methods can be used to assess the stage of neuropathy and also allows for a specialized treatment of stages to be made. There are many new techniques that can be improved upon as the field is relatively undeveloped. The 4 main types of nerve imaging techniques include magnetic resonance imaging, otherwise known as MRI, diffusion tensor imaging, otherwise known as DTI, ultrasound, otherwise known as US, and positron emission tomography, otherwise known as PET or PET. As we learned in class, MRI works by introducing a strong net magnetization through the body's tissue. An RF pulse is then generated, causing the hydrogen atoms in the body's tissue to emit radio signals that are then detected by the machine. Magnetic resonance neurography, otherwise known as MRN, works like a traditional MRI to image nerves inside the body. MRN uses a T2-weighted MRI scanning method in which a longer T2 gives stronger signals that usually serve to emphasize water, which will appear brighter compared to other types of molecules. MRN is currently the best method for imaging nerve neuropathy. However, it does not give much insight into the electrophysiology and the quantitative data of neuropathy. Because of this, MRN is typically not used to design treatment plans for patients, as the relative stage that the healing process of the neuropathy is currently in is usually unknown. Additionally, due to the traditional MRI trade-off between resolution and field of view, MRN is typically not used to image long nerves as a whole. Here is an MRI of 2 nerves, where one nerve is uninjured and one nerve is injured. The injured nerve is differentiated from the uninjured nerve as it is distinguishable from the surrounding muscle. DTI, otherwise known as diffusion tensor imaging, excels where MRN often fails, able to image the electrophysiology of the neuropathy and gives insight into what stage the neuropathy is currently in. However, DTI has a very low spatial resolution and is typically not used for imaging. DTI uses MRI to track the diffusion of water molecules inside the nerve. It uses the fact that water diffuses differently in uninjured and injured nerve, in which that water usually diffuses in a straight line in uninjured nerves, but in injured nerves, water typically diffuses orthogonal to the nerve in injured nerves. Coefficients that DTI is used to calculate include eigenvalues for water diffusion that is parallel or perpendicular to the nerve, fractional anisotropy, and the apparent diffusion coefficient. The 2 coefficients calculated from the eigenvalues including fractional anisotropy and the ADC, apparent diffusion coefficient, are very important for evaluating different nerve injuries. FA is used to evaluate how well the nerve diffuses water in a straight line, and ADC is the best for detecting tumors within the nerve. Here is an image of DTI that is used to image nerves. As you can see, the spatial resolution of DTI is much smaller than that of an MRN. However, the nerves can be quantified as seen in the image. The nerves have a high FA region. That means that they are likely healthy and project water in a straight line. Ultrasonography typically sees limited use in the medical world when trying to image nerves. As we learned in class, ultrasound works by using piezoelectric crystals to generate high-frequency waves that are used to image different structures of different attenuations. Nerves can be differentiated from blood vessels in ultrasound due to the fascicular pattern of the nerves that the blood vessels do not have. Ultrasound is typically used as a supporting tool, such as when trying to guide anesthetics into a nerve. Ultrasound is heavily affected by a variety of different parameters, including age, gender, race, and just how the patient is positioned on the operating table. Despite this, ultrasound sees frequent use due to operator bias. Here is an image that is generated by ultrasound that visualizes the biceps femoris muscle on the top, the catheter in the middle, and the sciatic nerve in the bottom. Ultrasound is being used to guide the catheter to the sciatic nerve. Finally, for our very last imaging method, we have positron emission tomography. As we learned in class, PET works by first attaching a fluorine molecule that emits gamma rays to a glucose molecule. The glucose molecule is then introduced to the nerve, where it is then consumed by metabolism. But in the entire process, when it is being consumed, the fluorine molecule will emit gamma rays that is imaged by the PET scanners. PET works to identify injured areas, as usually injured areas have a higher metabolism than uninjured areas. However, at this current stage, PET is typically used to identify tumors within the nervous system instead of lesions. Tumors typically have a high metabolism. Here is an image of nerves that was generated by PET. As you can see, the nerve on the left has a much greater concentration of fluorine molecules that emit gamma rays, meaning that it is likely an injured area. Contrast agents are typically used to, as their name states, increase the contrast of the image generated by the imaging method. Contrast agents are mostly used in MRI, but do find their ways in different modalities. Typically, macrophages can transport contrast agents into the injury site, where they can then work their magic. In MRI, contrast agents typically work by altering T1 and T2 relaxation times. Recently, new nanoparticles that can be created in the lab can also be used as a treatment or can also be used to visualize drug delivery. In summary, each imaging method has their own advantage and disadvantage and something that they at least excel at. MRN, otherwise denoted as MRI in the table, is extremely good for imaging nerve and nerve damage, but cannot evaluate the extent at which the nerve is injured. DTI is extremely helpful in quantifying the degree to which the nerve is injured, but is not so good at actually imaging the nerve and its injury. Ultrasound is extremely helpful when trying to administer different drugs using a catheter into a nerve, but it has a relatively poor resolution and is not the best for actually imaging the nerve and looking for injuries. And finally, PET is extremely helpful when trying to find tumors in the nervous system due to the increased metabolism of the tumor, but is not so good for imaging other things such as lesions. As of now, MRN is the gold standard for evaluating nerve injuries, whereas DTI is the gold standard for evaluating nerve health. Ultrasound and PET do have their limited uses as of now, but however they could see greater use in the future as more research is done with them. Here's the article where I got all of my information. It was a pretty good read, so I would suggest you check it out yourself if you have the time. That is the end of this presentation, and I really hope you enjoyed and maybe learn a couple of things. So